Hello everyone, myself Nikita Gore and my today's topic is appendix. So what is appendix? Appendix is a narrow blind tube with one end closed and another end communicating with cecum. So we'll see the common disorder of the appendix, that is appendicitis. Acute appendicitis and chronic appendicitis are the two types of appendicitis. So acute appendicitis, what is it? It is an acute inflammatory condition of the appendix, and a position of this appendicitis will be the right iliac fossa. In among the 9 quadrants of abdomen, the position is the right iliac fossa. Means there will be pain in right iliac fossa. Then we'll see the symptoms of acute appendicitis. Right. So what are the signs and symptoms of the appendicitis? Will be the pain. First sign will be the pain. There will be pain, means spasmodic type of pain, sudden pain. In acute condition, there will be a acute violent shooting type of pain. Okay, so pain will be at umbilical region, pain will be at the epigastric region also, and pain from beginning in the right iliac fossa. Okay, so the next sign will be the vomiting. Vomiting will be due to the spasmodic action of the pylorus, spasm of pylorus. Okay, so vomiting will be present there. In some condition, there is also a temperature. In all patients, there is pain, vomiting and temperature. So rise of temperature to 90 degree to 100 degree Fahrenheit. So next sign will be seen in that patient will be the constipation. Constipation is always present in patient of acute appendicitis. There are two main types, that is acute and chronic of appendicitis, but in acute appendicitis also there are two types, like with obstruction and without obstruction. And in chronic appendicitis there are 3 types, that is chronic recurrent, chronic simple and appendicular dyspepsia. So next we will see the physical signs. How will you diagnose that you have an appendicitis, because it may get confused with another disease, like right. So if you are getting the pain in your abdomen, so in whole abdomen also, and in right side of the abdomen, right side of the abdomen, left side of the abdomen, so you will be confused, right? So you should consult your doctor, because appendicitis is a very life threatening clinical condition, may be proved. Okay, so it is a serious disorder, you should consult. Any type of pain, don't ignore it. Okay, so next will we see the physical sign. Physical signs like Rosin signs will be positive, means pain will be shifting type from if we palpate the left side of the abdomen, the pain on the appendicular region on the right side, that is known as Rosin signs, is positive. Then patient will look in anxiousness. Patient will anxious, there is a dry tongue, increased pulse rate, increased heart rate, increased respiratory rate. This will be the signs will be seen in that patient, because pain is so violent, shooting type and unbearable for the patient. Okay, so next sign, there are so many signs like Cope's obturator test is positive in that patient. Then tenderness, means pain on palpation. When we palpate his abdomen, then there will be a pain, right? So then rebound tenderness. When hand is removed, palpation is over, then there is also pain, that is known as rebound tenderness. Then we'll see hyperesthesia, means extreme sensitiveness. Patient can't touch that part, that is pain. Patient does not allow physician or doctor to touch that part, that is known as hyperesthesia, means very sensitiveness. Okay, very sensitiveness patient in that patient. Then we'll see next will be Cope's obturator test. This will be sign positive in that patient. How will you manage it? So in acute stage, homeopathy works well. In first stage, means acute stage. Okay, so homeopathy have a very good management over the appendicitis, and that can prevent you surgery. Okay, immediate appendicectomy is required. I'm not saying immediate appendicectomy, surgical removal of the appendix is not required, because appendicectomy is required in that case when the patient is child and last stage is there, patient can't bear the pain, patient is very old, and there is an appendicectomy is inadvisable for the patient where the fate has gone to the stage there is a appendicular lump formation. In that case we can't do surgery, we can't remove the appendix, and appendix is rich in lymphoid tissue, means hence known as abdominal tonsil, but itself get infection, means lymphoid tissue of the appendix gets infection. In that condition appendix should be removed, so don't ignore it. Okay, So we'll see the homeopathic management for that. First medicine, we'll see the phosphorus. There is a intensive pain. There is a tenderness over the McBurney's point and shooting type of pain at right iliac fossa. So, and as soon as water or food enters in stomach, it gets warm and vomited out. So pain and vomiting both are present. So we will give in that condition, and stomach temperature is also rising, means Murphy's triad is seen. So we'll give phosphorus for that patient. Next medicine will be the arsenic album. In arsenic album, there is the inflammatory condition of the appendix will be there, and in that condition, with inflammation of appendix and appendicitis, means inflammatory condition is due to the cold food, ice cream, or improper boiled food, or any type of food. So in that patient will give arsenic album. Then belladonna. Another is acute remedy for the appendicitis is a belladonna, because belladonna is looking for remedy for the homeopathic physician to give, because belladonna is given in acute condition when there is acute pain, okay, at a right iliac fossa, and patient will look red, flush face, okay. So patient look red, eyes also look red. So in that condition we'll give a belladonna. Next medicine will be the carbo-vegetabilis. Okay, carbo-veg will be given to the patient of appendix who have heaviness, blotting sensation in the abdomen. We have seen that the patient with acute appendicitis are suffering from constipation. So we'll give the carbo-veg, and there will be pain at retrosacral position of the appendix, which is the commonest type of appendicitis. Okay, so we'll give them, and pain will be gone to the epigastric region. Okay, so epigastric region, so we'll give them. Next medicine like lachesis, when there is a tenderness and congestion, both are present, and patient can't bear the touch of the closes also, means these closes it can't bear touch. Okay, so in that condition there is a whole hyperesthesia present, so we'll give the lachesis to that patient, and patient does not allow physician to touch, in that condition we'll also give lachesis. The next medicine will be the pulsatilla. Appendicitis or pain in the stomach, distended abdomen due to the undigested fatty rich food. So in that condition changing type of pain also present. In that condition we'll give the pulsatilla. Okay, so next medicine will be the gratiola. Gratiola for the recurrent type of appendicitis. So these are the medicines we'll give in the condition of the appendix. So consult earlier when you have pain over any region of the abdomen, all over abdomen, in the epigastric region, umbilical region, right side of the abdomen, left side of the abdomen. So you should consult. Don't ignore your pain. Okay, thank you.